Can a blockage to a blood vessel to the brain cause a headache? A question from one of our followers. The answer is yes, it can in very specific situations. So the blood supply to the brain is complex. We have two major blood vessels in the neck, from the back and the front. They meet and form a circle, and from the circle, it's called the circle of Willis, the blood is distributed to the brain. So essentially, if you have a blockage in one or two blood vessels, slowly is not going to affect the blood supply to the brain. However, in certain situations, if you have a blockage to those blood vessels, it can cause a headache and other symptoms. Those situations include if the blockage is sudden and acute. So if it happened abruptly, suddenly, yes, it can cause a headache. Then if you have a large blockage to a major blood vessel causing a major stroke, you will have a headache. However, you'll have other symptoms including numbness, tingling sensations, slurred speech, weakness, a headache, or even nausea or vomiting. Next, if you have a blockage to specific areas of the brain like the thalamus. The thalamus is the sensory relay of the brain. So the sensory input enters the brain through the thalamus and gets distributed. A stroke to that area or a blockage to that area can cause headache. Then you have what's called the sinus system, the venous sinus system of the brain, where it drains the blood in certain situations, especially in pregnant females or people who have coagulopathies. Then you have a blockage of that system or the venous system that can cause headache even if the blockage is slow. And finally, if you have a bleed, so if you have a disruption of the blood flow, if you have from a bleed to the brain, then this can cause headache. So a blockage of a blood supply to the brain can cause headache only in specific situations that were mentioned. Thank you.